Good evening, everyone. Welcome to the school board meeting. We always start with a pledge. Kathy, could you lead us, please?
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We're operating not at full strength tonight. Mr. Niedermeyer had a little outpatient surgery and can't be with us, and Mr. Tenelli was on a well-deserved vacation in Florida. But we will carry on. So let's start out with the approval of the agenda for tonight's meeting.
I'll move for approval of the agenda as presented. Right, do we do that? Yeah.
Yep, second.
Okay, second. All in favor?
Aye.
And approval of the...
Yeah. I move we approve the January 3rd, 2022 regular board meetings as presented.
Second.
All in favor?
Aye.
Aye, thank you. And we will go right into the student body report. Regina?
Oh, it's kind of long,
Well.
actually. High schoolers have started their scheduling meetings for the fall, so we're already in prep for 22-23. Athletes are doing very well going into the second half of their seasons. The boys' game supposedly started 2 minutes ago in Caledonia. And the hockey game, I don't know how things are going. Normally, Mr. Tenelli would tell me. So,
Right.
Ice and athletics both took first last week. My athletics team is first in their division, and they only have 1 meet left. And as for ice, I have this long list of reports because we dominated. Emily Sullivan got first in literary analysis. Joe DeBell got first, Poppy Thomas got second, and Will Sheener got third in the dramatic monologues portion. And Jasmine Roselski got third, and Jesselyn Kelly got first in the creative writing portion. The double team of Poppy Thomas, Cindy Matthews, and Sophie Princey got 4th place. The white team, see the theme here, blue, white, double. The white team got 2nd place. That was Will Sheener, Rafia Bilgetch, and Jasmine. And the blue team took 1st place, and that was Joe DeBell, Emily Sullivan, and Jen Kelly. So we won the cup for like the 9th year in a row, something like that. Yeah, I did well. We picked a new show. Surprise, we're not doing 9 to 5. So our drama club is under new direction, which Howard took over. And we will be doing the 25th annual Putnam County Spelling Bee.
Huh?
Process that. It's a really long title. It's going to be a fun show, though. There's audition prep in Miss Howard's room right now. Auditions are Thursday and Friday. Rehearsals will start next week. And the show will be Friday, Saturday, the 18th and the 19th of March. The 18th is evening. I'm not sure if it's 7 or 7:30. I don't think that's finalized yet. And then the Saturday is afternoon and evening. So 1 performance Friday night, Saturday week 2. Yes, we're starting next week. It's a very quick turnaround like Little Women was, but we're excited. Due to illness, the Fine Arts Festival, which was the jazz band show choir a cappella concert, got postponed to March. May or may not have been partially my illness, but and then that's going to be like the first week in March, they tell me. And then midterms are next week. Our senior high all-county chorus is that first weekend in February, but that's like all the way in Warsaw. So we do have participants. Are there any questions? There's long.
Excellent report.
Very nice.
Thank you very much. Jamie,
Hi.
you're up.
Well, there isn't as much as she had to report, but Mathletics came in 2nd for their first meet and 3rd for their 2nd meet, but an overall of 2nd place so far, and they have 1 meet left in February. The middle school and high school student council recognized Officer Brado on January 10th in honor of National Law Enforcement Appreciation Day. We can't thank her enough for keeping our school safe. And midterms are happening a lot this week for middle school students, and high school's next week. And for sports, there isn't a lot, just boys modified. Basketball has been doing well at the start of their season. Any questions?
Excellent report. Thank you. Thank you very much to you both. And we'll go right into mental health update. Mrs. Miller, maybe you'll introduce our guests.
Absolutely.
Okay.
So, I don't know, would you like us to just hang here?
It's
Yep,
wherever you're
so,
most comfortable.
Yep, whatever you want
You
to
guys
do.
have a preference as you're the guests? Okay.
Yep, it's fine.
We also are not at full capacity, as we were supposed to have 3 other people with us this evening, but for various reasons. I don't think there's a good time to schedule much of anything because you're always making adjustments. So yes, I did want to share and have people see who's in our building. Unfortunately, those 3 people aren't here, but the agencies and organizations that we have partnered with this year are. So just wanted to share a little bit about our focus and why we brought some different organizations in this year, as you know, mental health and social emotional health was on the forefront as we're re-entering schools. And we have a great mental health team already in place in our buildings, both at the elementary and high school level. But we knew we didn't want to, you know, overburden them with everything that was coming in. We all were taking a role in mental health and supporting students. So as a result of that, we partnered with 3 different organizations.
Do you want me to click?
Sure. If you're not sick of the triangles yet, you know, you might be seeing more of them, but I did kind of review our multi-tiered systems of support when we were discussing some academic data. Just want to bring us back to that one more time because this does also apply to our behavior and social emotional support. So again, we had a lot of tier 1, which is again for all students in place with our mental health staff and with our teaching staff. And support staff in terms of some SEL second step lessons and support. But we also wanted to bring in some more things to support that tier 1, but also as students needed more support, some things that went up the ladder for a higher intensity of support. So I'm going to kind of go over that with our partnerships this year. Again, trying to be systematic and work collectively with outside organizations. So the first group is Center for Dispute Settlement. So I have Clayton here, who had partnered with us before, and if you were on the board previously, he also zoomed in to kind of illustrate and share a little bit about our partnership that we piloted a couple years ago, and in terms of focusing on community circles, restorative practice, and restorative justice. We added this year an AmeriCorp member, Zadie, who unfortunately was unable to be here today, but we'll kind of review what her role is. So part of our partnership with the Center for Dispute Settlement, again, focusing on relationships. That was something that came out of some staff at the middle school, high school, as an area that they wanted to focus on. We had done some things internally, but nothing that was very systematic. So we did a pilot with the Center for Dispute Settlement and had some after-school optional opportunities for staff our first year. Going into this year, we had staff from middle school, high school, and elementary trained to be restorative champions. We did that over 4 days, so we have people in-house that are able to facilitate the relationship building and community circles. So that happened this summer. We also have monthly meetings with those individuals. Most recently, we did some work with our mentor interns, so Zadie facilitated a session with mentor interns. We worked together to plan our opening conference day and community circles so everyone in the building could experience those, and have a upcoming plan for our next conference day to again utilize that model with our staff to look at some actually student data at our next Friday. So again, the focus is that tier 1, everyone has access, and Zadie's role is really to kind of support that work that we started previous years for those individuals that are looking to continue. I know everyone builds relationships differently in their classroom, but it's kind of more systematic and a structure to the community building circles. So that's a little bit about the Center for Dispute, where we've been, and the next slide is a little bit about Zadie's role as a AmeriCorp member. So this is some data that she had collected during her time here. She is primarily at the middle school, high school. That's where her location is. So she's outlined just you know, the number of teachers that she's worked with. One of the things that came out of mental health team meeting at the middle school, high school was supporting our new students. So she facilitated some opportunities for lunch bunch. Cafeteria isn't always the place where students want to hang out. Sometimes it is because it's social, but for someone that's new, it's a little more challenging. So she facilitated some lunch bunches with our middle school, some middle school students, inviting them, and high school students. She's continued that work. Our middle school students are really enjoying that, and it's not just new students, they've brought other friends to those opportunities, so she's done that. And she also provides conflict coaching and mediation. So oftentimes if there's a student conflict, that often can end up in the office of Mr. Bailey. And so she's there to also mediate or help students work through something that they might have had a conflict with a peer. So that's really been her role. I don't know if you have anything else to add to that, Clayton.
All I'll add is that for us, the best form of conflict resolution, and via our Mediation Center, is proactive community building. And while we know that happens everywhere in schools, we feel strongly that it requires very intentional time and space to get the most out of community and get the most out of relationships. And that's what Zane's been able to do, and that's what we're working with many members of your district to provide a real systematic effort going forward. And we're happy to be partnering and look forward to more training and program development going forward as well. Here for any questions, I'll be lingering through the meeting. So, let me know.
Thank you.
One of the things that we know that we didn't have a lot of information about was student social emotional. So we have so much academic data, and like I said, I went over that before. We didn't really have any input from students about how they were feeling, their self-awareness, their self-management. So we are in the process of administering a survey at the elementary level, and which is completed at the middle school, high school level. So that's some of the data that we'll be looking at as a team next Friday. And that will also help us know, how are we doing in these areas? Are these supports helping? Are students feel connected? Do they feel a sense of security and safety? So that will be nice information that will be a little bit more tangible than just, yeah, kids are feeling good, or, ooh, this isn't looking really well. So that'll be nice because we can offer or administer that survey 3 times a year moving forward. So we'll have some winter data, and we'll have some spring data for this year.
And I think that information is really important, because I think, you know, as I've listened to the board, they have really wanted to hear that data, really truly know how our students are feeling, what we're doing well, and maybe what things we could improve on. So we're really happy to hear that there's that data that we can share.
And then our next partnership is with the Center for Youth. So our Center for Youth Services, we have, when we brought all these groups on board, we decided Center for Youth, their individual kind of support the elementary building, and a Center for Youth, or Center for Dispute Settlement, the AmeriCorp member would support middle school, high school, so that we weren't getting confused and people were in one building one day and other buildings. But a lot of their support is very similar. We just utilize Jessica, who unfortunately couldn't be here tonight, a little differently. So again, she's on the ground tier 1, supporting teachers, participating in circles. I know Paul, this is Mr. Clark, Paul, will share some data that they've collected with Jessica's time in the elementary. But again, her main focus is supporting all students and staff at that tier 1 level.
Yep, and again, I'm Paul Clark. I'm the Director of School-Based Programs for the Center for Youth. And one thing I want to stress here is that this is it's a prevention model with social emotional support services that we deliver. We don't wait for something to happen in order to then deal with it and work through it and, you know, all of that. We are out there, you know, working with young people in all different types of venues. And all of our work is very restorative, similar to Center for Dispute Settlement, where there are a lot of circles that are held. We also do a lot of, again, the prevention piece of that. And one of the things that we do that we really focus on is we initially start with if there's an external behavior, if the young person is acting out, but we want to help identify what that internal drive is. What is behind these behaviors? What are these struggles? And it really does run the gamut of all the issues that young people are struggling with, especially in these days of the pandemic and the struggles with that, the transition, the struggles that families have. So our staff member is able to get to the root of that and be able to identify additional resources that young people need. And I respect, Superintendent, your, the comment about data and everything, and because that, it's always a great thing to be able to work and build relationships with young people, but you also have to have that data to drive what services, identify best practices, and what the culture of the school community is. So I just want to share this really quickly, and again, this could be disseminated if need be. Since the beginning of the school year, Jessica has had over 1,400 visits with young people. But let me just put that into perspective, okay? Of those 1,400 visits, contacts that she's had with young people, it was 110 different students. So it's obviously a number of students need, consistent support. That does not mean that these young people are running out of class, kicked out of class. It's that she's connecting with them, checking in with them to make sure that they are successful, both academically and socially, emotionally. The number one age for accessing our services in about, let me just see, make sure I got this right, about 35% are the nine-year-olds, is the majority of the young people that are accessing services. 80% of them are male that we have had contact with and have worked with. There's one other thing here I wanted to share with you really quick. A couple of the things that we do in regards to intervention that we do, the actual work, is that a lot of it's in-class support. So Jessica's actually going into the class to support them, to keep them connected to class. And that right there is about that contributes to about 64% of the services that we provide are actually right in class, working with young people, and again, keeping them connected to class.
What's a good example of this, sorry, Stephanie, is I was doing an observation of a teacher and was in a 5th grade class, and I actually saw Jessica walk by a classroom, stop, and come back.
Mm-hmm.
And she obviously has a connection with a student in that classroom. He had put his hood up and had his head down. She knelt down, they went for a walk, got a drink of water, I'm not sure what happened down the hallway. He came back, and shortly after that, he put his hood down and was able to participate in the lesson. And so really that proactive measure, so it kind of happens very seamlessly, but when you think about what potentially she prevented as far as that student acting out and then not being able to be part of that lesson, it was really just a great experience to see that happen. It just happened so naturally and so fluidly.
Any questions for Mr. The last level, as I kind of referenced the pyramid, is more near the top. So a high level of service. This is not a service that a student can just kind of pick up. There's a conversation with counselors, there's a conversation with parents, and that's our services from Rochester Regional. And so Bill Peterson's here tonight, but Lindsay is the mental health therapist that's on staff. So again, the reason that we partnered with them is that we were able to actually provide a location for students to get services in school. So there were partnerships before, and for whatever reason, those weren't as successful because I think the support and the consistency. Lindsay is in our building every day. She does service students. She is able to service students, as you say, K to 12. And really to provide the level of support that the students have maybe exceeded the ability for the school to be able to support them academically and social emotionally. So she's adding another layer. And through that support, we are also able to connect students to a psychiatrist. So that's a little bit about Rochester Regional. They are, do I have the number correctly, 20? I don't know if it's increased since then, since our last conversation. So Rochester Regional has been connected with a number of schools in Monroe County, and through an article I read, that's how we ended up connecting with Bill, so that you could bring those services out to Livingston County. So I don't know if you have anything to add to the overall.
Yeah, first of all, it's an honor to be in Geneseo. The Rochester Regional is committed to the community, and our community is just not Monroe County. We are so very committed to that. The exciting part about what our program offers is we've eliminated barriers to service. It's a long way to go to Rochester. It's a long way to get to Dansville. It's a long way for a parent to get out of work, because it's a finite number of times that you can get somebody outside of school for an appointment. So what our service provides is an ability for a parent and a child who probably would have not gotten that service to get a service that's going to meet their mental health need. Currently, we have 6 of our 23 students attached to a psychiatrist for medication management to address their anxieties, their depression, with their self-harm thought. The pandemic has just done a number to our children, and it's really meeting a need. I kind of always try to say is, rather, there's the clinics that people go to. Rather than Muhammad going to the mountain, we brought the mountain to Muhammad. We want them to eliminate any barrier we can to be able to provide that service. We are in 10 school districts. We're in 60 schools providing this service. It's much different than anybody else has been able to do it. You do provide, we go through their health insurance, but you do pay us a consultant fee. The model really is presided around the ideas. We're a business, there's no question, right? We gotta have productivity. But by what you provide for us is our ability to participate in the mental health team meeting, to meet with the counselors, to meet with everybody, to keep that communication open, to be able to get that, like, my favorite would always be Dr. Gardy, our psychiatrist, goes, did you get the Vanderbilts done? Well, to try to get a Vanderbilt done at the clinic, get that to a psychiatrist, to get that documentation, understanding what that child's about, is nearly impossible. Now is, yep, we got it, here it is, and here's the communication. We have more communication to provide a service that's deeper than what I think typically is provided in an outpatient clinic. So we're very excited to do that. It's just, I think it's a great model that we're proud of, and nobody else seems to want to do it, and we do. The part two is I want to say we partner with these guys as well. We'll talk with people. We'll say what's going on, and we'll join together at times on kids and help to do an intervention that's going to be in the kids' best interest, not always somebody else's in the school, whatever. We really try to do that.
And next slide just has Lindsay's credentials, and she came in a little later just with onboarding, so just some amount of students that referrals she received. Again, typically that goes through our counselors or an administrator. And again, the work that you've done in the area too with connecting with pediatricians.
We do. I reached out to all the pediatricians in the area. We want to address the whole child, and that's the educational, the mental, and the physical health. So we have that communication going on to make sure we're addressing it. So that we address all of that.
So again, we wouldn't expect to have a ton of students receiving that support, but still want to be able to provide that support for those that need it. And the last slide that Lindsay created was just about some of the different potential reasons that a student may be referred or she may see them.
Any questions for Stephanie or anybody, any of our
From the
presenters?
board? We are so grateful to all of you. The board has talked a lot about this, and kids need support and help, and it's a complicated world, and we're grateful to all of you. And thank you, Mrs. Miller, for coordinating the whole thing. And this is really good. Kids can't learn, if they're upset.
Yeah.
So this is just a wonderful program, and we thank you all, and thank you for taking time out to meet with us tonight.
Again, it's an honor to be
We're
here.
very grateful.
With what Dave said, it's just, nice to see us looking at the whole child, recognizing that the needs of students have increased exponentially in the pandemic, that the needs of staff members have increased because of that, and realizing that, stuff still needs to happen a day-to-day basis, and the extra support is just, sounds great. Everything you're doing looks and sounds awesome, and you know, the one quote out, removing the barriers for families, so clutch. You know, I think we've seen that with Cindy with COVID testing in the building. There's so many things that we're trying to do to help families, and I think this is just another level of that. So, you know, thank you to Cindy and Stephanie, whoever else involved in getting this going, because as we know, Stephanie, so you're sitting here at the moment, there's so many layers to things that happen. So, nice job, thanks.
Great.
Yeah, certainly, kudos to Mrs. Miller, because coordinating and having 3 different agencies come into a building 1 year and not only work with our students successfully, but work with each other successfully. So also thank you for your collaboration amongst you all, because sometimes you can run into territorial type programs and services, and we haven't seen that at all, which is extraordinary. So thank you, and we look forward to our continued partnership.
Thank you.
Just a little sidebar to this. I did call Lindsay today. I said, Lindsay, I have a person who's applied for a job someplace else that's from Geneseo. Would you think, just put it there, she goes, no, Geneseo's my home. She doesn't want to. I said, oh, okay, and I'm not going to call that person.
Terrific.
Good to hear.
Good deal. Good deal. Thank you again.
Thank you.
Yeah, I mean, we are going to have a stimulating conversation about our budget.
Yeah.
So you're more than welcome to stay. But
We'll
you're
pass
also-
on that.
Thank you, everybody.
Thank you.
Thanks again. Great. Well, we'll turn this over to Mr. Forrester, our CFO, as I call him, who's going to
Sir?
give us an update on the next budget.
So every year we start out here just by talking about our rollover budget. And just by way of refresher, we keep our revenues mostly flat, and we'll get to why it's mostly flat. Expenses are then allowed to increase by what we know they're going to increase or estimate they're going to increase. And really the whole point of the rollover budget is it's that worst case scenario of where we would be. All of our expenses went up, but our revenues remained flat. And so on the revenue side, we're going to assume that our pilots stay absolutely flat, that there's no increase in the tax levy, and we're going to use the same amount of reserves and fund balance for 22-23 as we have in 21-22. So this is a little bit tough to see, maybe a lot of it tough to see. But why we're saying mostly flat, where we used to say totally flat, is the governor here has committed to fully funding foundation aid. And so for us, that looks like about an increase there of about that $285,000. What's going on here?
He's just trying to move that bar for you.
Oh, okay, I thought I was doing something. We also know that there's a little bit of increase in BOCES aid. That's a total guess. We know we're spending a little bit more money there. We know we'll get some BOCES aid, but so that number is a little bit of a guess. Right underneath that bar that you can't see right there is the tax levy staying the same, our reserves and fund balance staying the same, but you can see there's a negative 111 right here. You'll recall in our current budget, we're pulling money out of our debt service fund to pay some of our, thank you, John, to pay some of our debt service in the current school year. So that's a one-time revenue. We knew it was a one-time revenue, so that's right here, and that's going from $111,000 down to zero. It will make our auditor happy to clean up that debt service fund and get that out of the way. So our overall increase in revenues is looking somewhere about $180,000. Now, in the governor's budget proposal today, she did fully commit also to fully funding expense-driven aids, transportation aid, high-cost aid, building aid, BOCES aids. Those aids that you spend money in year one, you get the money coming back to you in year two on those expenses. So we'll have to dial in those numbers. They won't change a ton, to be honest with you, from year to year. Our special ed population's pretty consistent. Our busing is pretty consistent. Our BOCES services are pretty consistent. So you're not going to see big swings one way or the other, but we'll have to dial those in over the coming weeks and months as we move forward. So those would be our revenues. about $21,637,000 there is just our estimate for this evening. John, I'm not moving. Can you advance that one slide? Perfect, thank you. So we know we're gonna have some increases in salaries. We know BOCES is gonna have some increased costs that they're gonna pass along to us. We're estimating that's gonna be right around 5%. We do get some pretty good relief in ERS that's dropping from 16.2% to 11.6%. So again, by way of refresher, for every dollar that we pay in ERS salary, we have what's called the employer contribution rate. So we have to pay this year, on current year salaries, 16.2% of salaries, and next year that's going down to 11.6%. Teacher retirements going up just about, excuse me, just under 0.75%, which I'm going to argue is pretty manageable. That's pretty manageable for us. But this guy right here, not so manageable. Healthcare premiums are going up between 20 and 25%. And my understanding is that's pretty much across the board. Like, so we're in the Finger Lakes area school health plan, and so we're at between 20 and 25. Genesee area health plan is going to be very similar. That's what's being suggested to them. I don't know what their board will adopt. Monroe County is also very similar, upper teens to low 20s. Clearly that's got a lot to do with the pandemic and what's going on there, but that number for us represents just about $450,000 in increased cost. And this will be the roughest year because you've got to add that into your budget, but then it's got to stay there because it's not like those premiums are going to come down, okay? So if you'd have asked me 3 months ago, I would have told you the 22-23 budget will be pretty okay. We know we're going to get some money in foundation aid, or at least that's what the governor has promised. We've got some, what I'm going to say are modest increases in salaries, and we've been okay. This is a big number. That's pretty tough. We'll figure it out for sure, but just, you know, it's going to really hurt us a lot. So if you look here in this column on the left, that's your 21-22 current year budgeted expenses. And then over here on the right are what we're looking at for 22-23. Again, just that rollover budget, increasing those salaries or those expenses that we know and kind of guessing at some others. Salaries we know are going to go up. Again, we'll dial those numbers in a little bit more over time. Again, we are getting the savings here of about $100,000 on ERS salaries, and going up by about $12,000 on TRS. Again, I think that's pretty manageable. BOCES, we're just throwing that 5% in there. You know, we may have to look at some of those BOCES expenses. We may have to be a little bit more selective in some of the services that we do provide or we do purchase through BOCES. But you can see here in that healthcare line, right, that's that $450,000 we were just talking about, okay? And that's just, it is what it is. That's premium increase. You know, if your car insurance goes up, you still have to have car insurance, and this is pretty similar. This debt service number right here, we built in to the 22-23 school year a debt service payment on our upcoming building project. And we may or may not have to do some of that depending on where our tax cap falls and trying to manage our tax cap and our capital exclusion within our tax cap and that kind of thing. So right now today, as just a starting point, you see we're underwater by just under $900,000 for next year. Okay, so just a starting point, just as a jumping off place for us to get started. So what is the takeaways from this? We're $898,000 roughly underwater today. Again, that's that worst case scenario, and it's just the starting point. I probably should have put the last bullet to the top. Don't panic. We'll get through this. This isn't meant to scare anybody. I do want to say that. This isn't meant to scare anybody, make anybody nervous. Nothing like that. This is always intended to be that worst case scenario, what happens if? And we'll continue over the budgeting process here between February and March, dial these numbers in and come in with a good responsible budget. So that's where we are tonight on the 18th of January, and we'll get better over the next little while. So questions, comments, concerns?
I'm absolutely delighted that we don't have to fight the expense-driven aid battle again this year.
Well, that is true.
I'm just thrilled about that.
We do not, that is true.
So that's good. That's good.
All right then, have a great night.
Thank you. Thank you.
As John is pulling up my PowerPoint, I don't know if you noticed, we had a little bit of snow yesterday. And just really want to publicly thank our buildings and grounds crew. When they were able to get unstuck from their own personal driveways, they reported to school and actually worked from approximately 2 in the afternoon yesterday until 6 a.m. this morning, nonstop, getting our school ready and open for our staff and students. Now, as you heard from Regina, she was kind of giving me a little rib this afternoon because we didn't have a snow day. Well, it's because the buildings and grounds crew was here all night long and made sure that we were open. We still have some work to do. Our campus does make moving snow challenging, and so we know that in the next coming days we'll still be continuing with our snow removal and continuing to open up all of our exits and make sure that we have a safe campus. Also along those lines, our buses are stored outside, and so Mr. Ballard sent me a picture of him and his daughter yesterday cleaning off the buses. They were both over their knees in snow with great big long scrapers pulling the snow off. So again, without those extraordinary efforts by Jay and his family, and then Tim coming in this morning, moving all the buses, getting them warmed up, so that we could finish plowing. It's a great team effort, and I just wanted to publicly thank everyone. So it didn't happen without a lot of work. So as you know, our struggle with COVID-19 continues, and as I get to later, I have some updates about quarantine and isolation. As you know, we did launch our community testing, and January 7th we did that. As of today, we've had 68 families request an appointment. So very busy with that. Anybody who calls and requests an appointment is either given an appointment that day or early the next morning. So really trying to be very responsive in our time with our families. And it's important that we are, because as you see, our positive cases are increasing, and at quite a quick rate. We had 37 positive students today. Actually, I think by the end of the testing day, it was 39 students. So we are seeing that increase. Luckily, we are at 5 positive staff members, so that does help us keep our doors open. But luckily, the other thing that we're hearing from parents is that yes, students are positive, but they're not having the symptoms and the reaction that we saw last year with students, or even earlier in this school year. So it does seem like the Omicron variant isn't hitting our students as hard. They have colds, and they're able to get over it within their quarantine period and then return to school and be successful. What that has caused for our teaching staff is to juggle many, many different starting points and catching students up, and kids are in and out, and that is challenging. That is very hard to teach a class where you potentially have a third of your class out. They're all coming back on different times, so that is very challenging, and they're working really hard to keep up with the response to the COVID-19 pandemic. So since December 23rd, I think we've received 8 memos changing the quarantine process, the isolation, who it applies to, how it's going to apply. So as of today, January 18th at 7:40, our quarantine period is now 5 days. Fully vaccinated close contacts can participate in the test to stay. So it's just non-fully vaccinated, not fully, non-fully vaccinated. So anyone who doesn't have their full vaccination status can participate in the test to stay. And you know, we talked at the last board meeting that we did open up that household contacts can now participate in the test to stay, and that is 5 days in a row. So if mom or dad are positive, the students can ride the bus in, be tested that morning. If they test negative, they're allowed to stay. So this was changed in December because they were not allowing us to test household contacts. Anybody with a household contact, everyone was automatically quarantined unless you were fully vaccinated. So we were thankful for that because that is where we're still seeing a large number of our students test positive is through a household spread. Fully vaccinated close contacts don't quarantine if they're asymptomatic. At any point that they start to exhibit a symptom, they should quarantine, act as if they're positive, and then they can test once their symptoms subside, or they can just return to school. So they're really starting to loosen things up. Livingston County, along with New York State, you probably saw in the news, they are not doing contact tracing. So that's really falling on us as a school district. And so what we're doing is when we become aware of a student or a family member who is positive, we do that contact tracing within the house and instantly offer them the test to stay, opportunity to stay in school. This morning, our nurse Heidi Mueller was unable to be in today. She got held up with some weather issues. And so this morning at 7:30, we had 15 people ready to be tested. So it was a busy morning, but the good news is out of 15 tests to stay, there was only one positive. Throughout the day is when we really noticed the uptick in positives. And so, you know, the other thing with those numbers is that they are going to change daily. So as I looked at our quarantine, we have 10 students who will be out of isolation as of tomorrow, off quarantine. So our number will instantly drop tomorrow morning, to 25, or 39, where we were at the end of the day. So it's very, there's lots of moving parts, and we're just doing our best to stay with it. And I'd be remiss if I didn't really thank Heidi Mueller and Sherry. Sherry schedules every appointment when it is requested by a family. When Heidi, myself, Mr. Saltel are unavailable to do a test, she is putting the gloves on and running out. We've trained her in testing, and so it's a all hands on deck operation for this. So, but really, Sherry and Heidi have taken the lead, and I need to thank them for all their work. Capital improvement plan. We're at an exciting point with our capital improvement plan. So our bids are being accepted until February 2nd. They will be open in a public session in the auditorium at 3:30 p.m. Again, there is that piece about the lowest bidder, and so that will be taken into consideration as we select our contract. The contracts will be presented for the board approval at the February 17th board meeting, and our construction begins in early spring. So really excited about where we are in that process. So both students mentioned that they are in midterm exams, and one of the things that happened this year is when the Regents exams were canceled, unlike years in the past, they said that the 180-day and the 990-hour requirement must still be in place. So typically, if you have a Regents exam on that day for your 9 through 12 students, you're allowed to have your students come in for a Regents or a midterm and maybe have a half day. Maybe they're only in there in the morning, they come in the afternoon. That was not allowed this year. There was not a waiver option where we could get away from not totally meet that 990-hour requirement a year. So that led to challenges of creating our typical midterm schedule. We couldn't do what we've always done. And I really, again, just want to thank and commend the team leaders. They are very creative in creating a schedule that will work. There's some block scheduling happening for teachers who don't have a midterm so that other teachers can do a midterm. And it really was just everyone working together to make that happen. So, and thinking outside the box. Sometimes in education, we all, myself included, we get a little stuck in doing what we've always done, and sometimes looking at things differently can be hard. But that certainly wasn't what happened this year with our 9 through 12 midterm schedule. So just wanted to publicly thank them for their work in that area. And we did have an executive order has been extended, allowing for virtual meetings due to the pandemic. So if we felt that we were unable to safely have our meetings in person, we do still have the remote option. I don't know the date that it has been extended to, but it has been extended. So again, if we felt that we needed to move to a virtual meeting, we do have that, availability. Any questions?
That was a lot.
It was, it's, in the 2 weeks, we've been busy.
You know what the attendance was today for students versus say?
So I
Friday?
did look, yep, and I don't, it was at 12% in the middle school, high school, we're out, and 16% in the elementary. I was curious about that myself, Mr. McDonald, like, oof,
Okay, thanks.
absolutely.
Thank you, and thank you to your clerk for doing extra duty. I don't think that was listed in the job description.
It wasn't, but it's okay.
So we really appreciate that, thank you. Moving along?
Moving along.
Okay. Do we have,
Audit finance?
oh, we don't have anybody,
No
no?
one signed up to speak.
Okay.
Oh, yeah, that's right.
Mr. Phelps,
We
would you
haven't
like to
met-
take?
We haven't met since,
okay.
nothing to report since the last meeting. That's
Okay,
it.
very good.
We'll meet again next time.
Okay. Great, great. Policy committee, we did meet tonight and reviewed, well, it's 5 policies, but there's one that we pulled for now. So we'll probably see those for first reading next time. School safety plans, code of ethics for board members, equal employment opportunity, drug-free workplace. Those items are there already, but may need a little fine tuning. So you'll see some of those, I think, next time for first reading. And GCEF.
They continue to do their amazing
They-
work. We haven't met.
they-
We probably will meet soon though, because we do have the community faculty basketball game coming up in March. I don't have the exact
Oh,
date, but
right,
they
right.
are still planning that, so I'm sure they'll want to meet soon.
Great, good. So let us move right into personnel.
Yep. I would make a motion for a consent agenda for items 7.02 through 7.10.
Second?
Any questions from the board members on any of those?
If there are no questions, I would just like to wish a few people well. Emily Kane, our 5th grade ELE teacher, she has decided to stay home and spend some more time with her newly born child. So just want to wish her well in that endeavor. Our school nurse, Carol Schrader, has taken a job closer to home in her home district. I can certainly understand the motivation to do that, so want to wish Carol well in her new position. And as we look to the resignation of our bus driver, just really want to thank Bill Devine for his work here. He has also another important job and has just found it to be too much to be a full-time bus driver, but has agreed to be a sub, as you can see in the next line. So we're very thankful for that. And also excited to have someone helping us out in the maintenance department. Sam Court, how do you say his last name?
Close enough.
Okay, we're saying that's it. You know, we'll start tomorrow and helping
Yeah.
us out. So looking forward to having Sam on board and helping us out.
Great,
Excellent.
thank you. Any other questions? Then all in favor of that motion, say aye.
Aye.
Aye. Anyone opposed? No one opposed, thank you. And we'll go to new
Under
business.
new business, I make a motion for consent agenda for items 8.02 through 8.05.
Second?
Thank you. Any questions on any of those? Everybody good? Okay. Then all in favor of that motion, say aye.
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 Anyone opposed? Unanimous, thank you. And then business office.
Business office, I'll make a motion for a consent agenda for items 9.02 through 9.04.
Second.
Okay, questions on any of those?
(9.02) is accepting a donation to the 5th grade whale watch trip. As I mentioned in my weekly update, unfortunately, we're not going to be able to travel to Boston with our 5th and 6th grade classes. So they are going to look at doing some local trips that will be during the same time and hopefully will meet that need. So they will utilize that money towards the local trips that they will be taking here.
Good. Okay,
Need any workers?
you good? No,
Actually, I would,
did we vote on?
no, we didn't.
Okay.
Sorry.
All in favor of that motion, say aye.
Aye.
Aye. Anyone opposed? Unanimous, thank you.
Just jumping ahead there.
So I think we're good, no need for an executive session.
I will make a motion that we.
But before, just before you, a couple of really quick things. First, Mrs. Miller, I was going to mention, and I neglected to, about your pyramid, and no, we're not tired of it.
Okay.
And it's good for lay people, particularly me. It makes it easy to understand what you're trying to do, so thank you for that.
Yep.
The other thing, we talk about your evaluation of it. As part of Cindy's evaluation, we do a formal one towards the end of the school year, but as part of the process, we have a half-year, mid-year check-in. And so she's submitted some information on that super eval website, and we're gonna have to give Kevin some instructions on how to get there. So please look at that, and then we'll do an executive session at the end of next meeting to just talk about where we are and how we're doing and that type of thing. Any questions about that thing? Okay, good. All right, I think we're done.
I will make a motion to adjourn at 7:53.
I will second.
All in favor?
Aye.
Aye. No one's opposed.